Well, hello, everybody. Welcome to IRG's Start or Sit podcast. This is our podcast. We talk about NFL injuries, particularly who's injured, particularly who was injured last week. That would be last week in week 10 and coming up week 11. Are they going to start, i.e. is the injury significant enough where they're going to have to sit or start, so to speak? So joining us, like always, is Dr. Chris Hawkins, orthopedic surgeon, sports medicine specialist from Washington Orthopaedics down there in Olympia, Washington. Dr. Hawkins, how are you?
Hey, I'm doing great, Shannon. I can't believe we're 2 weeks away from Thanksgiving. So, it's I'm getting excited for family and to eat a whole lot.
Oh, me too. Me too. I was thinking about that this morning, 2 weeks from today, and I'm going to go on a crash diet so I can eat a lot. Yeah, good luck with that, right? Fasting. Yeah. I'm Google Fast. I've been Googling fasting all morning. So anyway, yeah, that's great. I love this time of year. Thanksgiving, I tell you, but just so everybody knows, Thanksgiving, I think, is my favorite holiday. How about you?
Yeah, it's got to be great. There's not too much pressure. You're not worried about disappointing somebody with presents and stuff. Yeah. You just get to sit around and eat and watch some football. So.
Yeah, did you, speaking of Thanksgiving, watch some football and stuff? I mean, I used to always enjoy, is it Detroit Lions and the Cowboys always played on Thanksgiving? Or was the Redskins? Who was it? They always played.
Yeah, no, you hit it right. It's always Detroit's the early game, Dallas is the late game. That's right. Been going on forever.
That's right. That's right. I always liked John Madden. Always had a turducken. I liked John Madden. He was great. Turducken. Here we go. Week 11. Start or sit. Dak Prescott. We talked about Dak a little bit last week. Last week, what we knew is he had a significant hamstring strain. He did not play last week. I think Cooper Rush, who replaced Dak a year or two ago when Dak had that terrible ankle fracture. But now we're coming out. Dak's got an avulsion of his hamstring. He has to have what I'm assuming is season-ending surgery. I mean, his season essentially done. But I'm gonna throw it over to you, Dr. Hawkins. You're the expert here. Tell us about a hamstring avulsion. He's having surgery. What does that mean? And what's the follow-up and the rehab? And when's he back?
Yeah, so it's obviously not a super common injury that you hear about. For those people who like to get out here in the Pacific Northwest in the summer, this is sort of like the water skiing injury. So you're in a situation where you have your knee extended and you get pulled forward very quickly. And what happens is those hamstring three main muscles that come up and attach to what's called your ischial tuberosity, sort of the sit bone in the back there. So they all come together into sort of a common attachment. And you know what? For someone like you or I, we're not spring chickens anymore. A partial avulsion injury oftentimes can respond very well to some rest and some rehab. And some protection. And I've even taken care of some decent athletes at the triathlon level who've actually gone back to competing, at a master's level after pretty significant injuries here. But in his case, I think the number of people he saw, he got a few opinions. They basically told him, listen, you're either going to have to shut yourself down and rehab it, and then there may be this potential for causing a worse injury in the future versus shut it down, reattach it, and then say, okay, that chance of re-injuring it's going to be lower. So he obviously made the decision with his crew of what to do, but yep, they're going to go in and reattach this common origin. Yeah. And it can be a little bit of a touchy surgery. So, he's been through some big stuff, but that attachment's right next to the big sciatic nerve. Oh, yeah. And so, oftentimes patients can have some temporary or longer lasting nerve symptoms after operating in that area. One of my good friends who works in New York City and takes care of a lot of these, he'll actually do it in conjunction with a neurosurgeon who actually their whole job during it is protecting the nerve while he reattaches the hamstring tendon. So yeah, it's a big surgery, and he'll, like you said, he'll be out, the rest of this year. But we're kind of wishing him the best, even if you're not a Cowboys fan.
Yeah, absolutely. He's a great guy, and he's had, significant injury. I think he had a fracture dislocation of his ankle, not last year, but the year before. He came back, and he was having a good year. Now, I was watching this game, if I remember right, where he was injured, and it was a fairly benign maneuver, and you're exactly right. What it looked like he was doing, he looked like he was trying to throw the ball over the lineman, so he kind of went up and elevated and extended on that leg, and he grimaced. and I don't think he could release the ball when the pain happened and the ball was short, and everybody was saying, oh, what's going on? Did he hit his hand? I think if I remember right, come to find out, he was that mechanism, that extension, and that pull. Now, Dr. Hawkins, when you talk about an avulsion, generally speaking, when we hear the word avulsion in medicine, what we're seeing and we're hearing is that the tendon didn't tear. The tendon stayed intact, but pulled off a small chunk of bone from that. You call that ischial tuberosity, that bony attachment site. So is that fair to say that they're going to reattach that bone back on that ischial tuberosity, or is it am I on the right track here, so to speak?
Yeah. You can have these avulsion injuries that have a big chunk of bone.
Yeah.
Oftentimes, it's literally just the very surface of it, what's called the periosteum.
Oh, yeah.
Sometimes even on an X-ray, it's hard to see that little sliver. But the good news is again, that usually means there's been no what we call like plastic deformation of the tendon. So the tendon didn't get stretched out.
Yeah.
It's intact, and it came off at that attachment. So the good news about those is they're the healing potential is great, and a partial one is less risky, I guess is the best word to say, because you don't have to retrieve the tendon from further down in the thigh to reattach it.
Yeah.
So it makes all those other risks a little bit lower. So hopefully, like I said, he has a quick surgery and a good recovery.
Yeah, good. Thanks for the explanation. Dak Prescott, if you have him on your team, he's done for the season. That's for sure. And I like Dak. I like who he is. I like his play, and I only wish him the best. That's a big injury. This NFL, by the way, everybody listening out there, this NFL is a tough game. I mean, it is. Look at the injuries we have every week. We have somebody to talk about. And speaking of a guy that's had some injuries, Aaron Jones, running back, Minnesota Vikings. I think we talked about him last year with some injuries, but he's got this rib injury, and it sounds like he is hit or miss. He played a little bit with it, but again, it's a chest rib injury. You think he's going to go?
Yeah, everything's pointing in the direction he'll play this week. We've talked before about how this is one of those injuries it's all about pain tolerance and oftentimes what position you're playing. The quarterback who's going to get guys landing on him all the time is going to have a little harder time with this. Running back's kind of right in the middle. You take hits, but you usually are in a protected position when you get hit. So they're being careful with him in the practice setting to avoid aggravating it, but it looks like he will be a play this week.
Okay, and then let's see, Vikings. This is the Vikings are looking good. I mean, they're 7-2 right now, having a pretty good season. So, and I think he's a pretty integral part of their team, and probably an integral part of some of your folks out there, your fantasy football. Here's a guy I'm sure everybody has or wish they had. I don't know, Tyreek Hill. I've been watching him a little bit. Miami Dolphins wide receiver. Apparently, this guy's been playing a little bit in the past. I don't know if it's the last 1 or 2 games. He's been playing with what they call a torn ligament in the wrist. Don't know what ligament it is. Don't know how significant it is. They're keeping an eye on him. He played against the Rams. I think the Miami Dolphins beat the Rams on Monday Night Football here a couple days ago. What do you think, Tyreek Hill?
Yeah, so it's actually come out that he's been nursing this along for a while. It goes back, in the preseason they have some of those weeks where they do like a combined practice with another team, and they were practicing, I believe it was with the Commanders, and he basically came out and said that's about when he started to have wrist discomfort. So he's had it looked at by a couple different specialists. It hasn't come out officially, but it sounds like this is probably a scapholunate ligament injury. So that can be a bad one if it's a complete tear, but it sounds like he has a partial tear of that ligament. He's decided to let pain be his guidance, and he's accepted the fact, from what he's told the reporting staff out there, he's accepted the fact that if it's worse and it's bothering him more, that he may have surgery when the season's over, but that he plans on playing through it. And now that we know that it's been going on for 8 to 9 weeks, I think he'll be a play this week.
Play. Tell me, when you talk about the scapholunate, just for our listeners out there, those are those what we call carpal bones in your wrist. And those bones, those carpal bones, I mean, you have to remember as you're listening, they're all connected by ligaments. It's kind of an interesting area. It's very complex, that wrist transition spot there. And that lunate bone you're going to feel that pain like what we call the snuff box. And is that usually when you dislocate that, is that usually a fall on that arm or that hand? What is the mechanism that usually get that injury?
Yeah, it oftentimes is a fall with sort of like a hyperflexion or at the wrist level. And you brought it up well that it's complex. So there's 8 bones that are sort of anchored together there by ligaments. And then as a result, they allow you to flex, but that's multiple bones moving against each other. And so the concern again is, you can do things with a torn scapholunate. You probably would struggle if you're a quarterback and you had to have good control gripping the ball to spin it. But otherwise, it's a pain thing. And it's really a lot of times it's the long-term sequelae, like 9 months, a year down the line, that if you don't fix a complete rupture, all those bones start to shift position. Yeah. And therefore, you start to get arthritic and other issues. So that's where I think he's made the somewhat educated decision that he's got a window of time right now where, you know, and they've come quite a long way. I'm not one of the hand specialists, but they've come quite a long way with being able to fix these and rehab them relatively quickly and stuff and not have a lot of atrophy and stiffness afterwards. So an off-season procedure for him wouldn't hold him up from returning next season.
Yeah, he's a play. Probably will be a play the rest of the season. Here we go. This is kind of I've adopted this team a little bit. I got to admit, I do like, I hope I don't offend anybody out there or make anybody irritated, particularly if you're an Eagles fan, but I do like the Detroit Lions, and they play with grit. I don't know if anybody saw that game. They came from behind. I think they were 15 points down, ended up beating Houston Texans, and I like Houston, right? They're both, what a great game. But Sam LaPorta, he's a Detroit Lions tight end. He's got an AC joint separation, and he experienced that in this game. And I think he's, day to day, it sounds like they're resting him. They're kind of. I think they're going to look at him at practice tomorrow or something. But we've talked about the AC joint. It's this separation. It's super painful. What do you think on Sam LaPorta?
Yeah, the sort of late-breaking news is they kept him completely out today for practice. So that trend, as we've seen it in the past, is not a good trend for playing this weekend. Because of, what a good team they are this year, especially offensively, he has not had that amazing year he had as a rookie. He's been solid, but they've had production from everybody across their offensive set. So they're running back, their wide receivers. So for those people who have him, I would put him as a sit this weekend because, like I said, they're trending him time-wise to rest it, and he hasn't been as crucial for them this year so far. So I think they feel they can probably play a game and give him a week to recover.
Yeah, it's interesting, and I think we talked about this at one point in time. As you move through this season, you start to work on strategies based on where you're at in the season, and also probably based on your record. Here we go. The Lions are 8-1, and they're playing the Jaguars. No disrespect to any Jaguar fans out there. I apologize, but the Jaguars are 2-8, so they probably feel like they can sit LaPorta this week, get him rested. I'm wondering in Week 12 not to put you on the spot, Doc, here, but has Detroit had a bye yet, or do they have a bye coming up? I wonder if they're looking at a bye next week, maybe gets 2 weeks out or something like that. But he's a sit. That's what you're saying. I think that's a good guess. We'll look at that bye maybe a little while here. Jensen, our producer, is going to look it up and tell us. DK Metcalf, being a Hawks fan, come on, go Seahawks. Wide receiver. He has been he rested 2 games, and then he had a bye, so he's been rested for 3 games. They got the 49ers. This is a divisional game. Seahawks are 4-5. 49ers 5-4. Everybody talks about the Seahawks are a different team without DK driving the field, okay? DK Metcalf. Play this week number 11, going against the 49ers. He had 3 weeks rest, MCL sprain. Is he a play? What do you think, Doc?
Yeah, I think this is the classic example where, he and his training staff have been, playing chess and not checkers. So they were looking at that long-term 2 steps, 3 steps ahead. Because I think his initial injury, he would have played a little bit sooner. But I think they had their eye on this San Francisco game, having him at full speed, ready to go. So they've taken him slower, I think, than average, took advantage of that bye week, and he will be a play this week.
Okay. DK Metcalf, good for the Seahawks. He's a play. By the way, Jensen just informed me that the Detroit Lions experienced their bye in Week 5. So they're going to rest LaPorta this week, most likely, but he will be back soon. Keep an eye on that. Michael Pittman, Indianapolis Colts, wide receiver, back and finger. It just says, don't really know what's worse here. They're pointing to him probably playing. What do you think?
Yeah, he's so his finger injury was the minor one of the two. He was mainly having some low back pain, no structural damage. He was basically a full participant today in practice. So he's a full go this week. And then the big news for Indianapolis is they've got Anthony Richardson coming back now after sort of taking that back seat to Joe Flacco for a few games. Pittman will be a full play this week.
Michael Pittman, Jr., Indianapolis Colts, wide receiver. Play him this week. He's going to go off. Joe Flacco, man, that's a guy we need to talk about sometime. Just talk about, Iron Man. I mean, what is the guy, 57 years old? Playing, I'm just kidding. He's been around for a long time. Pretty amazing. I like to watch
Delaware
this.
Grad.
Yeah,
Delaware
there you go.
grad.
There you go. There you go. There you go. Here we go. I like to watch this guy run. This guy runs hard. I like him. Najee Harris, Pittsburgh Steelers. He's got an ankle problem. And Pittsburgh is a 7-2. Hey, this is a big game. Pittsburgh, 7-2. Ravens, 7-3. Sunday, game of the week on your channel. You can watch it. But is Najee going to play? What do you think?
Yeah, Najee looks like he's a go this week. They've been kind of just resting his ankle. It's not a high ankle sprain. It's one of those ones where he's probably had a low-grade sprain, and they've been just limiting his reps in practice. The expectation is their backup, Jalen Warren, is pretty solid as well. So I think that, again, Baltimore defensively is not what they used to be. So I think that plays into, Najee likes to be a hard runner. And I think they're going to really have to try to control the clock because, as we've all seen, Lamar has been just outstanding for the Ravens this year, and they've been putting up so many points between him and Derrick Henry.
Yeah, two great teams that like to hit. This is the bruiser game, so to speak. Najee Harris, I agree with you. He's going to be a play. I mean, who was it? It was last Sunday. I'm just thinking about an ankle injury. It was a quarterback, I think, and they went out and they went into the tent and they taped him up, and he came back and he played. And oh man, I'm losing. Do you remember watching that game? It was the NFL. Do you remember that, Doc? Did you see that at all?
I'm not. I don't know which one that one is.
Yeah, probably happened like 10 times last week, and I remember that it was what I'm trying to say here is the medical staff they have on the sidelines these days and what they can do for these athletes and the technology they have, not only in the OR and the surgical procedures, minimally invasive, et cetera, but just, the rehab and training and assessment, it's pretty impressive. It really is pretty impressive. Here's a guy that I like. I really like this guy. I like this guy because I watch quarterbacks on Netflix, and him and Patrick Mahomes and Marcus Mariota was on there. But this is Kirk Cousins. Traded to the Vikings after he tore his Achilles last year. He goes to Atlanta, and he's got the Falcons playing they're playing really well. 6-4, but they play the Broncos 5-5. Kirk has, at the end of the game, got a little right shoulder, a little elbow problems, but I don't know if it's going to keep him out. He was limited to practice on Wednesday. What do you think?
Yeah, they the late breaking Twitter news on him was that he was a full go in practice today. So from yesterday to today, it sounds like it was just soft tissue injury, little contusion. He felt good today. Went through a full practice, no setbacks. So Kirk Cousins will be a play this week against the Broncos. Yeah,
absolutely. There you go, Kirk Cousins play. That is our week. Going into week 11, our Start or Sit podcast here with IRG Physical and Hand Therapy and Washington Orthopaedics with Dr. Christopher Hawkins, orthopedic surgeon, sports medicine specialist. And a big shout out here. We're going in this week, like I said, week 11 here. I want to shout out and thank Jensen Chrysler, our producer, kind of the guy that runs the show Jensen. Here. Good job, Jensen. Baby. So Jensen gets all the injuries and kind of researches them, keeps us on point. Thank you, Jensen, for your time and effort. And Dr. Hawkins, thank you again for your expertise. And we'll see you next week. And that next week will be 1 week closer on Thursday. We'll be 1 week closer to Thanksgiving. I'm excited. Hey, real quick,
Yep.
Dr. Hawkins.
Start the fasting.
Yeah. I'm going to start it tonight. Yeah, that's right. Hey, real quick as we wrap up. I mean, you got to have your East Coast guy, Philly, raised tough, but you got to have a favorite pie at Thanksgiving. Come on, show us your soul. What's your favorite pie?
I'm a pumpkin pie guy.
I love it. There you go. So am I. All right, there you go. Take care. Thanks, Dr. Hawkins.
Right.
Bye-bye.
Yep, take care. Bye-bye.